I am Dr. Suri Raju, urologist, Regal Hospital. Kidney stone is one of the most common urological problem encountered by physicians, general practitioners, urologists, nephrologists, even quacks. What is kidney stone? Why it is so common? Routinely I come across people. If I talk to some XYZ person, they will tell, I am suffering from kidney stone. My family is suffering from kidney stone. I took treatment. Kidney stone is one problem with a lot of controversy about the treatment also. Each person will give different treatment. There is no fixed protocol with many doctors. And anybody can give treatment for kidney stone. This is a reality. Kidney stone is not new. Some 200 and 300 years ago, Napoleon, a well-known king, suffered from kidney stone. Because of the pain, he postponed the war. Even it is described by one of the famous well-known surgeon, Sushrusha, in 2000 BC. It is well described by Hippocrates around 2500 years back. He says, kidney stone should be operated and handled by an expert who is expert in that field. It was written some 1000 years back. The pain is so excruciating pain will be there. Sometimes it is difficult to differentiate heart attack, pancreatitis, acute appendicitis. It is so painful. What is kidney stone? The stone which is occurring in the kidney, ureter and the bladder is kidney stone. How the kidney stone occurs? Many people still have a feeling probably it is because of the consumption of stone in the food. It is wrong. It is a blood disease. The solid items which is present in the blood get precipitated in the kidney, leading to kidney stone formation. Why it occurs? It is because of the decreased level of water in the blood. In the blood, so many elements like calcium, magnesium, phosphates. These items will be in the dissolvable form. When these elements increase, they get precipitated in the kidney, leading to kidney stone formation. It varies from 1 millimeter to approximately golf ball size also. I have seen 1 millimeter stone patient will be having severe excruciating pain. 10 centimeter stone, there will be no pain. Pain will occur only if the stone comes and blocks the urinary tract. Otherwise, they will not have any. So, it is very important. People who are working very hard in the fields consume less water with some family history and the previous stone formation history is there. These people are more prone for kidney stone formation. Even people who are obese. So, coming to the symptoms, how you will diagnose kidney stones? Some people will have pain abdomen, some people will have blood in the urine, some people may have fever with chills, and 30% of the kidney stones will not have any symptoms also. Some we have seen with nausea, vomiting is the only symptom. Some people will find difficulty in passing the urine. Doctor, I am not able to pass urine. I am finding difficulty. So, how to diagnose kidney stones? Simple. You need not undergo any IFI investigation. Basic investigations like ultrasound, urine examination, then blood investigation was kidney stones. Sometimes X-ray abdomen will tell. But it is not always true. 70% of the stones can be diagnosed with X-ray. Another 30% is not detected on X-ray. Once the stones are diagnosed, we should always undergo treatment on the scientific basis. Doctor, some people have advised me to take medicines and I am taking medications. So, I need not undergo any kind of treatment, they say. No, it is better to undergo systematic approach, better to go by systematic approach. So how to treat the kidney stones? If the stone size is small, if it is 1 millimeter, 2 millimeter, up to 5 millimeter, drink plenty of water, some medications to relax the ureters, and stones will fall down. Medical enough treatment is sufficient. If the stone has come down and blocking the urinary tract, we can wait for some time. If up to 2 to 3 weeks is the waiting period. If the stone is not falling down, even with medications, better to undergo the surgical procedure. With the advent of endourological equipment and technology, with improvement of the surgical techniques, any big stones can be operated with minimally invasive, without any scar, and patient can be discharged within 1 or 2 days. Yes friends, today various treatment approaches are there. Ureteroscopy with the laser, if the stone size is 6 millimeter to 12 millimeter. If the stone is big in the kidney, percutaneous nephrolithotomy, minimal puncture and remove the kidney. If patient don't want any cuts, RIRS, kidney stone removal using endourological equipment with the laser is possible. Extracorporeal shockwave lithotripsy is advisable if the stone size is less than 15 millimeter. They do very well. Once the treatment is taken, most of the people forget for follow-up. Yes friends, kidney stones are known for recurrence. It runs in the families also. It is very important once in 6 months or once in a year to come to the doctor and do regular checkup with one ultrasound, one urine examination and blood investigation. If you do that, most of the stones can be controllable and curable. So, how to prevent kidney stones? This is one of the most common doubt what people have. I advise few tips. If you follow these tips, I am sure you will not suffer from kidney stones. What is that? Drink plenty of water. At least 2.5 liters per day in an adult is must. How plenty of water will help? If you drink water, it dilutes some of the solid items which are present in the blood will get dissolved. Whatever the salts which are deposited in the kidney are flushed out. And water will also prevent recurrent urinary tract infections. Again, recurrent urinary tract infection can cause stones. Number 2, salt restriction. I have seen people who take more pickles, consume more salt, they are known to develop kidney stones. We usually advise not to consume 5 grams, more than 5 grams per day. Number 3, sugar restriction. Sugar is also known to cause overweight. Indirectly, it contributes for the stone formation. Number 4, diet. People who consume lot of diet which is rich in fat, they are more prone for kidney stone formation. We usually advise green leafy vegetables and plenty of water, less restricted non-vegetarian diet. So some people who consume lot of non-vegetarian diet, they are more prone for stone formation. So restrict intake of non-vegetarian diet will prevent stone formation. So prevention is better than cure. Periodic checkup is very, very important. To conclude, drink more water, go for regular kidney checkup at least once in 6 months to 1 year. If the stones are already formed, sometimes we advise stone analysis to find out what is the reason behind the kidney stones so that we can prevent. Especially people who are having diabetes, they are more prone for uric acid stones, which can be prevented if they control their diabetes. And medications are there to control the stones also. Then once in a year at least, please go for kidney checkup. And today, most of the people with kidney stones can be completely treatable. And if you neglect the kidney stone, you are more prone for recurrent infection and kidney failure also. So you can't take things lightly. At the same time, some people have assumption if you take more tomato, seeds will cause stone formation. Actually, it is not proved. It is nothing to do with the kidney stones. And you can take anything. There is no restriction of the fruits, vegetables, green leafy vegetables. Drink more water along with the items. Restrict your salt. Prevention is better than cure. Control your diabetes. So these are the methods by which the kidney stones can be prevented. Stay safe and stay healthy. Thank you very much.